Welcome to A Day with Dr. J. On this episode of A Day with Dr. J, we're going to go over Graston technique, followed up with a Kinesio Taping technique for lateral epicondylitis, in layman terms, tennis elbow. We have Graston tools here, which we have 7 different tools. All of them are differently designed with different edges on them, just mainly for the practitioner in the area of the body that we're working on. Today we have Tresha here. She's a patient of mine. From her active lifestyle, working out, doing her things that she does in her job, she's developed some tennis elbow, and we're going to treat that today. Okay, so we're going to use Graston technique to treat this. Now, with lateral epicondylitis, people usually have tenderness in this point here in the elbow. And so what we're going to do is we're going to apply a little emollient here, and this emollient is mineral oil, vitamin E, coconut oil, and beeswax. We get a little bit of this emollient here, and we're going to apply it to the arm here. And so what we're doing is we're just getting this lotion onto the arm here. So I'm using GT4, which is the number tool here, and I'm using this and I'm actually feeling in the arm how the tissue feels here. And as you see here, it's starting to turn red. And so in the first phase of healing, that's the inflammatory response, and we're having blood come to the area here. The tool, actually, you can feel the different textures in the tissue when you're on the area. When you actually have tendonitis, there's actually a tear that's present there. So you can feel the dysfunction, and we can feel that right in here as we're going through it. We want to go long enough, and as soon as you start seeing that you're getting a nice response with the redness of the skin, if you see any capillaries that have started to burst, that's a good indication that it's time to stop, because after that you'll start bruising a person, and we do not want bruising. We're going to wrap this up, and now we're going to show you how we're going to Kinesio tape this afterwards. So now we're going to follow up with Kinesio tape. Kinesio tape, we're going to apply this because that helps get inflammation out of the skin. It's actually going to help lift the skin, the dermal layer, and it's going to increase the drainage and getting the inflammation out of the area. I've pre-measured a piece of Kinesio tape here. We're using Kinesio tape gold. Now, I always round and trim my edges when I Kinesio tape. Because if you round them, there's less chance of a shirt snagging it and lifting the tape. We're gonna keep the arm here, just like so. We're gonna create an anchor where we felt the area of dysfunction, and we never wanna touch the tape itself. So we take this off. We're gonna take this tape and we pull to 100% stretch, and then we're gonna drop down to about 50 right there. And we always rub this afterwards because we want to activate the adhesive here, and we want this area to be the tape to stay. You just saw a demonstration of Graston technique followed up by Kinesio taping technique to treat tennis elbow or lateral epicondylitis. Thanks for watching this episode of A Day with Dr. J. Remember, stay active, stay healthy. We'll see you next time.